A very warm welcome to you and thank you for joining us on Health and Wellness. My name is Zaitun Ali, and on today's episode we are talking about a topic we've not talked for so long as we mark the World Malaria Day, specifically to be held on the 25th of April. We want to talk about understanding malaria and also just create malaria awareness in Kenya specifically. So the theme for this year is Malaria Ends With Us, Reinvest, Reimagine and Reignite. So this is us here reigniting. So joining me in studio, I have Dr. Favor Kimunto. She's a physician from Luton Hospital. Karibu sana.
Thank you for having
me. I
me.
also have Lydia Mokeira Mumanyi, who is a patient and a victim of malaria, and is here to also share her experience, the symptoms that she went through, and so much more about it. Karibu sana.
Thank you so much.
Good to have you. Let's just start from the beginning, Daktari. What is malaria? What are the symptoms of it?
Okay.
Yes.
So malaria is a life-threatening disease that is caused by a parasite called Plasmodium. This parasite is transmitted by a mosquito. I'm sure you've seen mosquitoes all around.
Lazima tungesema life-threatening.
Yeah, it is life-threatening. It's one of the leading causes of infectious disease deaths in the world, and it's a public health concern. So not all mosquitoes cause this disease, just the female Anopheles mosquitoes.
I remember that in my day.
Yes.
So,
yes.
Okay.
He also asked me about the signs and symptoms of malaria. So malaria is one of those diseases that can initially present in a very vague manner. So you have fever, chills. But the thing about malaria is that this fever and chills can come periodically. So you find every 48 hours or 72 hours, you can have a fever spike. Also presents with general weakness. You're feeling so tired, you can't explain. You're having joint pains, body pains, nausea, vomiting, diarrhea, difficulty breathing. You can also have a variant of it which is called cerebral malaria, where you have even like loss of consciousness or even convulsions. So it's a variety, it's a wide picture of presentation.
So now this wide picture is what I want us to bring home, like we get deeper into it. Like you've mentioned, clearly there are stages of malaria.
Yes.
What are they?
So initially, broadly we classify them as uncomplicated malaria and complicated malaria. So maybe I can speak about complicated malaria, so now we can understand what the "un" means. So complicated malaria is where we have like end organ damage. This is, for example, you can have kidney dysfunction. So you have what we call acute kidney injury because of malaria. You have what we call anemia. This is where the amount of hemoglobin or blood in your or red blood cells, they go low to less than 7. Or you can have jaundice, where your eyes become yellow, signifying you're having liver dysfunction. Or you can have difficulty in breathing, what we call acute respiratory distress syndrome. So you can have that. Or even cerebral malaria.
So this one you can't say CM, like CP, cerebral palsy.
Cerebral malaria, yes.
Okay.
That now defines complicated malaria. So any other form of malaria that hasn't reached this stage, we call it uncomplicated malaria.
Even, you've mentioned about jaundice. Even for like the newborns, when they get it, is it also associated with the same?
Not necessarily. That one's really a different cause.
Okay.
Yeah.
So guys get it also when they're grown up.
Yeah.
Aja.
Yeah.
Okay.
Yes.
I didn't know about that. Okay. So when you talk about now all the stages, you've said the complicated one. So now this uncomplicated one, is it part of cerebral, or cerebral now falls where?
No, cerebral is complicated. So that means your brain has been affected. Because I said complicated when you're having organ damage, either your brain, your kidneys, your liver, or things like that.
Okay.
So uncomplicated is now the ones where you're just having fever, chills, the way I mentioned, you're having a bit of joint pains, you're feeling fatigued. That is now part of the uncomplicated malaria. Yes.
So how does it affect the brain when you're talking about cerebral?
So maybe I will need to go to the life cycle
of
the malaria for us now to understand how it affects the brain.
Please do.
So what happens is that first you get a bite from an infected female Anopheles mosquito. When it bites you, it releases a form of the parasite that we call sporozoites into your skin, and they find their way to your bloodstream. Then they quickly go to your liver. In your liver, they find a home there, they replicate in the liver. Then once they've reached that stage where we call merozoites, they're released into your bloodstream. So this is when now you start developing symptoms, because once they're in your bloodstream, they infect only your red blood cells. So they enter, like one parasite will enter a red blood cells, then multiply. Once they are many in that cell, they burst. then they go infect other new red blood cells. So that's how we end up with now the various symptoms of malaria. So what happens in cerebral malaria, you find that these red blood cells, they become affected, especially inside the vessels inside your brain. So they go and accumulate there. So you find blood flow is impaired inside your brain. As a result of that, you present with the symptoms, which can be seizures, where someone's having a convulsion, or the altered levels of consciousness. You find you're speaking to someone, they're answering you left, and you've asked them 1 + 1, So those are not the manifestations of cerebral malaria.
Oh, no.
Yes.
Okay.
Yeah.
To our patient, Mukira,
Yes.
I'd like to engage at this point. So what was your experience like when you got malaria?
So I could say everybody has their own experience.
Yeah.
For me, I had 2 instances where I was diagnosed with malaria. For the first one, I could say the symptoms were mild. They were not severe. I started experiencing fatigue, and then after 3 days of fatigue, and then I had hotness of body, that's spiking fevers, chills. I was taken to the hospital immediately, and tests were done. I was diagnosed with malaria, and it was managed well to recovery. For the second one, they were a bit moderate, so I had more symptoms than the first diagnosis. For the first ones, they were mild. This one, they were moderate. In that, I even experienced dark urine. When you pass dark urine, now you have loss of appetite, joint pains, diarrhea, fatigue.
They occurred almost the same time, concurrently, after a long period of time?
So I started by having general body weakness. I was tired for most of the days, and it was not normal. You're rested, you wake up in the morning, you wonder, I just slept. Why am I so tired?
Yeah.
And so it went on for a week. And then after a week, when I was sleeping at night, I just started vomiting, spiking fevers and all that. And then I was taken to the dispensary. I was done for run tests, and they discovered I had malaria, and it was managed. Yes.
Okay. So when she's talking about the 2 episodes, one would ask, first and foremost, people would say you don't get malaria like in Nairobi. Some of the myths around it, you just have to have traveled, umeenda mashinani kidogo. So is it true, like you can't get it here in Nairobi?
I think can't is a strong word.
Okay.
I think you can get it in Nairobi, but your risk of getting it is low. So you find that they divide Kenya rather into different malaria zones. So they're the ones we call malaria endemic zones around the lake regions. That's like around the Lake Victoria, or coastal endemic around the coast. They get a lot of malaria there. Then there's the highland epidemic prone areas. This is like now the highlands in Western Kenya, or Nyanza, Kisii there. So it's a highland place, but they are prone to having malaria outbreaks in those areas. Then we have what we call seasonal. This is the former provinces, the northeastern, eastern, those areas there. They are prone to having seasonal outbreaks of malaria. They're usually typically dry places, but when you're having like floods or those warm, humid temperatures, you can find an increase in the reproduction of these mosquitoes, and as a result you have malaria. So Nairobi and its environs around the central province, they are classified as low transmission areas, but there's still a risk. You remember, I think a few years ago they discovered a new subspecies within the peri-urban area called Anopheles stephensi that can lead to transmission of malaria. So you still can get it in Nairobi, but the risk is low.
It's low.
Yes.
Had you traveled, Mukira, at that time?
I come from Nyanza. So my home is in Nyanza. And so we are in those highlands from Kisii, as she has said. So I had happened to get one episode while I was at home and while I was at school. So my school is still in Nyanza, was still in Nyanza when I got the episodes. So I had not traveled. Yeah.
Okay. So now, when we're talking about malaria in these areas, so the symptoms that she has mentioned, what type of diagnostic test do we do, especially now, to determine this is malaria? Yeah. Umenishikisha. Umenishikisha. Yes, kwa cerebro. Malaria.
Yeah. So the test that we do, we have what we call the blood films or the blood smears. This is where I'm sure. Have you ever gotten malaria?
I have.
Okay.
Actually, I was in Oyugis, at that time, nikarudi, and I also used to study in my university, Eldoret. So after traveling from there to LD, I got it. And I think it hit that cerebral, because I remember even I could not even speak well.
Wow.
Even wash myself, like literally. I had friends who were washing me. It was a very tough time. Niliogopa nimekuuliza swali ya diagnostic test. Niliogopa sindano because I knew you're going, it's unadungwa pale.
No.
Bado niyo.
No.
Kuna ya kutoana
Upper. Yeah. So they use that to make what you call the blood films on a simple glass slide. So there's the thin one and the thick one. So the thick one, they use it just to tell you that you have malaria or not, or the severity, or how much parasites, or how many parasites you have. They're able to give us a percentage. Then what you call the thin blood smear is now used to determine which kind of parasite this is, because there are different kinds of parasites. Some are more harmful than others. We have the falciparum, we have bivax, plasmodium, we have ovale, malaria, knowlesi. So here in Kenya, the one that tends to cause more severe disease is the one called falciparum, plasmodium falciparum. So there are those I've mentioned, the blood smears, the thick and thin, but we also have the rapid diagnostic tests. The one, you just take a small sample. They're usually readily available in a variety of dispensaries and hospitals. So, but something else to note is that you can actually come with the symptoms of malaria and I test you and you're negative, especially with the blood slides.
Why?
So we usually say if you highly suspect someone has malaria, you have to do at least 3 blood slides before you can say they're negative. Because remember when I mentioned that when this malaria, when the plasmodium infect the red blood cells, they replicate and they burst. So when you test when they've just ruptured and you're having the fever spike, you're more likely to pick it up in blood. But when you test when they're asymptomatic, you may find that your yield is less. So there's that risk of having what we call a false negative. So apart from the diagnostic test, there's also the other test to just look at your organs, how are we? Like the liver function test, the kidney test, the chest x-ray. Those are just supportive tests to manage the complications now of malaria.
And the injection on the anus.
Anus?
Ame ilikuwa wapi? Basi huyo. Na daktari wewe.
Anus?
Wewe daktari wewe. Because it was in one of the dispensary.
Okay.
Yes, nakumbuka. And I was like,
No, but
I'll come back later. And for that reason, by the way, it went, malaria is ghetto.
No, let me just say, there is injection. If you're having severe malaria, it can be through the line IV or intramuscular. Not in the anus, in the muscles of the...
Ni hapo niko na track maanisha. Ni hapo niko na track sema. Hata kukaa ilikuwa shida for a very long time. But it's like I'm saying, malaria is ghetto. Because I remember when we were growing up, our parents would tell you, please, meza hii malaria queen, zilikuwa za yellow. Ni hizo zilikuwa za yellow. Kabla to travel, ndio mtu asishikwe. Because I also, even my mom is from Nyanza huko. Ulikuwa unaenda ucha lazima unapata malaria. So alikuwa ensure by the time natoka hapa mmemeza ndio muende. So really, was that helping?
Yes.
For real?
Yeah.
Please talk about that.
So it's called chemopreventive therapy. So if you're not, the way I told you that those areas where there's malaria, like the coastal areas or the Lake Victoria, around that region, you find because you're in Nairobi, maybe you've grown up in Nairobi or you lived there for so long, your immunity to malaria is low. So when you go there, you're sure, especially when you go there when it's rainy season, the temperature is just right, you're sure you'll get malaria. So you can prevent yourself. Usually there's oral therapy you take. There's a variety, like there's the common one, it's called Atovacone and Proguanil. So you take it like, most of these drugs you take them like 1 or 2 days before you travel. Then you take while you're there and up to 7 days after you leave. But others like doxycycline, you also take them 1 or 2 days before and take them for 4 weeks afterwards. So I think if you feel like you need to take these medications, you need to go to a doctor because different patients would fit different kinds of drugs. Because there are some which have side effects. There are some which if you take and you go to the sun, like doxycycline, you're likely to get sunburn or you can have gastrointestinal problems. There's some like mefloquine, you're more likely to have things like anxiety, depression. So there are those side effects that you have to be aware. And also, are you willing to take the drug for 4 weeks after you leave coast, you know? So you have to look at all those factors before you take those medications.
Hey, that's a lot.
But it's useful.
4 weeks, okay.
It depends
on a daily basis, like morning, evening, morning.
Just 1 tablet.
Oh, 1 tablet per day. 4 weeks. Okay. What kind of treatment did you seek when on the first or the second, which one, on both, which treatment did you seek?
Okay, now I could talk on both. I remember the first diagnosis that I got, I received a chloroquine infusion as we started with a loading dose and a maintaining dose for a day, and then I was released home on orals. So I responded quickly to treatment. I went back to being myself after a day of treatment. So saying to the first management, it was quick. For the second one, I remember I received now the injectables. It was not fun.
Yeah.
I received the injectables because I had lost appetite. I could not eat. I was vomiting. It was persistent. And so you cannot take orals while you're having persistent nausea and vomiting, and you cannot retain some bit of diarrhea here and there. So we opted to start with injectables. I received injectables until I was able to feed. Once I started feeding and I could retain feeds, and then I was now given orals for 3 days, and then I responded and I got better.
Okay, that's for the
Second now, the second
time.
diagnosis
Okay.
that was a bit moderate.
When was that?
And I was in primary.
That's way back.
Yes.
Okay, the day of late. I don't know. Is it that we are doing more awareness, a lot of awareness, or the treatment is like solid? We know when you get malaria, this is what we give you, and it's over and done with. Because nowadays it's rare. Can we say that?
No.
No.
Guy,
No.
kwani si tunaishi wapi?
You live in Nairobi, a place where the transmission is low. If you go to Nyanza,
Yeah.
they wouldn't say malaria transmission is low.
Serious?
Yeah.
Until this point?
Yeah. It's one of those things that WHO and the whole world is tackling. They've gained quite progress, like a huge progress in terms of reducing the transmissions and the deaths associated. But I think over the last 5 years, we are still at the same place where we were.
Okay.
I think very few countries have been able to achieve that malaria-free certificate. Like I think in Africa, we now only have, I think it's Cape Verde and Egypt who are given. So the rest of us are still, malaria is still with us.
So we're trying to see this theme,
Yes.
this year's theme,
Yes.
malaria ends with us.
Yes.
So what are we reinvesting? What are we reigniting from your perspective of that as a doctor?
So just to add to what, or to just follow up with what she was talking about treatment, you
Yeah.
asked something about how is the treatment now in this day and age.
Yes.
I think the government has really invested a lot together with our partners, the NGO partners. We now have guidelines based on the current resistance pattern to malaria that we have in Kenya, where if you come now with malaria, we have what we need to give. If it's uncomplicated, this is what you take.
Yeah.
If it's complicated, this is what you take. So we're no longer using you said quinine, so some of those things not commonly. Like for example, if you're to get malaria now and it's uncomplicated, you'll get what we call coartem, or what we call artemisinin-based oral therapy, combination therapy. So the combination of 1 or 2 drugs where they are readily available in the local facilities. So that's for uncomplicated malaria. And even for complicated malaria, we use something we call artesunate. If you for some reason we can't give you artesunate, the other option now comes to be quinine.
Okay.
Amongst other options. There are a number of options down the line. But this has helped to standardize care, because these drugs are now one of the essential medications that each facility should have. So nowadays things are easier. For example, based on her symptoms from her second case, you could tell it was severe malaria, because now her urine was dark, so her kidneys were getting affected. So for that one is the one where we give you IV artesunate, at least for 1 or 2 days. We see if you're improving, you're able to take orally, because sometimes when you come in really unwell, we give you the artesunate. Once you're able to take orally, we switch you now to the other one for oral therapy.
So at least the government is investing in the medication.
Yeah, and in Kenya, the parasites that we have are responding well to these medications, yeah.
Okay.
But we still have episodes or incidences of resistance, but so far I think the majority of infections...
meds are strong.
Yeah.
What?
Yeah.
Okay. Have you ever gotten malaria?
No, it's very small. I can barely remember. I think I was in lower primary.
Yeah. Oh my God. So we want to take a short commercial break. We are coming back with more about malaria awareness in terms of the treatment. And we see what we are investing, what we are reigniting at this point. And this is Health and Wellness. Don't go too far. We'll be back shortly. Welcome back. If you're just joining us, remember this is Health and Wellness. We are talking about understanding malaria and just creating awareness on malaria right here in Kenya. And we are marking the World Malaria Day. Hiyo ni April 25th. Theme tumesema ni malaria ends with us.
Yes.
Reinvest, reignite. Hiyo ingine tumesahau. Tuwezi sahau. Malaria ends with us. Reinvest, reimagine, and reignite. So I'm still joined by Dr. Favor Kemunto, a physician from Luton Hospital, together with Lydia Mukera Mumanyi. She's also a patient and a victim of malaria. I think we've all been victims. Please share your story. Reach out to us on our social media platforms at KTN Home on Instagram, on X at KTN Home, on Facebook at KTN Home, and also our WhatsApp line 0759434389. Karibuni tena.
Thank you.
And before the break, we were talking about there's a question I was asking even before we go to the preventative measures and everything. When you're seeking treatment, were you subjected to traditional remedies in whatsoever? Because umesema ulikuwa uko mashinani. Did they attempt to give you any kind of traditional remedies?
For my experience, I will say no. But they try the normal first aid things when you're having fevers, like exposing you, trying to wipe you with warm water so that they cool down the fevers before they seek medical management. So I could not say it's such as traditional or any medications, because after that first aid, they take you to the hospital for further management.
Okay. At least ulibahatika. Out here people, but does Mwarobaini really help? That thing is yak and people see it treats malaria like nobody's business. Does it?
I am a scientist.
Yeah.
I can only vouch for the drugs. I know I've gone through trials, been tried and tested, and they've been shown to work.
What are the myths that surround malaria and the symptoms and the treatments, everything that you'd like to dispel today?
I think for what I can say, like a majority of the deaths that happen because of malaria tend to happen 90%, they happen in the under 5, the children under 5 years.
Oh no.
And you find these are the children where the mother will tell, no, this is like, I think in the rural area, kids tend to have fevers, especially when they're teething, they can have a fever, or at some point when they're growing up, they can have this nondescript symptoms. So someone can say, this one we know it. This one it usually happens. Or it could be traditional chemistries that are coming up. Or my neighbors want to finish me, or it's the teeth. So sometimes that has been a challenge where people want to fast try traditional remedies. So by the time this child is coming, they're now in complicated malaria. We now have organs are failed, we are having issues, and we have to resuscitate the patient or to bring back the patient. So that's a challenge, but I can say for sure the efforts being done currently in these regions like in Nyanza and Coast, there's more awareness about malaria, what it is, how it presents. So I don't think it's really an issue nowadays, but the challenge that we are now having is where people just self-prescribe. That can also be a myth. Where any headache that you have, this one must be malaria.
I know, by the way.
By the time you come to me as a doctor, you're giving me a list of things you've done and tried. You know, you're like, I took malaria last week, and then I also took azithromycin, and then I also took cough syrup. So you wonder, so you've come for what now? Anyway. So that's a challenge.
For you to validate. What I took was okay. Guy, me, I'm guilty with the azithro. Any kind of azithro. Now, no, do you have to jaimaliza? Okay.
But did you know most flus are caused by viruses? And you don't need an antibiotic for that.
So
an antibacterial antibiotic. Yeah.
Okay.
Because azithromycin is meant to, ideally to target bacteria.
Yeah.
You have a virus. What are you doing? Anyway, that's a topic for another day.
Where?
Yeah.
Utakuona kando.
Yeah.
Guy. Okay, that makes sense. When we're talking about umesema coastal region, and by the way, I'm coming from places whereby malaria iko in high levels. There's this one thing in coast, they call it the dengue fever or something. Is it the same? Unapatanga hizo symptoms, ravi nishaipata tena malaria nikiwa huko coast bado. Kamboma ni dengue fever, is it the same thing?
They're not the same, but they present the same in terms of the high fever, the joint pains, but that one usually has like body rashes and things like that,
Okay.
So those ones are also spread by mosquitoes, but a different kind of mosquitoes. It's called Aedes, Aedes, A-E-D-E-S.
Oh.
Mosquito. These are the ones Anopheles. Yeah. So mosquitoes tend to be a lot around the coastal area, but now they spread different kinds of viruses.
Okay.
Or
So
diseases.
you can get that people.
So that's why it's important for you to go and be tested. Because you can say it's malaria and you have dengue fever. Or you have chikungunya virus, you know.
Yes, kuna hiyo pia.
Yeah.
Is that any different?
Yeah.
Sa chikungunya inaletwa nini tena?
It's a virus also, but it's also spread by the mosquitoes.
So mosquitoes zinatuspreadia vitu ngapi yaki kwa hii dunia? All that.
Yeah.
Plus now malaria. Okay.
Yeah.
So Anopheles is what we should look out for. Na tunaweza zi identify.
You'll insert picture here.
Okay, let's go to the preventative measures. What can we do?
What you can do, I think we can, because the aim is just to, first we want to prevent you from being bit.
Yes.
Second, we want to reduce we want you to reduce the amount of mosquitoes in the surrounding. So I think we can broadly classify them as that. And also to reduce the disease burden. Because if you're infected, I'm infected, and she's infected, or she's not, us two were infected and mosquitoes come and bite us, they're more likely to transmit to her. But if we are all tested early and treated early enough, the transmission in the community will be low. So first and foremost, there's the personal, like what you do yourself on a personal level. You can use things like mosquito repellents, where you apply on your skin, or if you know you're going to be outdoors during those key times, like during dawn or dusk, you can wear long clothing, like long sleeve. I know you're in coast, but you're slaying in long sleeved or long skirts to prevent the bites. Another thing you can do on a personal level is the use of insecticide-treated nets, not just any nets, insecticide-treated nets. So these nets, you find that most of them are usually distributed by government facilities, especially for the under fives. But they're very useful because not only do they repel the mosquitoes, they also kill. But there's some areas where they found the mosquitoes have developed resistance to these nets. So for those areas, you find that the government or the NGOs, they distribute nets that have been treated with like a super insecticide or something more to not tackle the resistance. So there's that. Talk about reducing the breeding grounds around you. So if you're living close to an area, like if you're living close to a lake, I'm sure you've seen those barriers, those very small barriers that you can, like the nets you can put on your windows to prevent them from coming in. Those small ones, like the mesh. You can have that. You can clear bushes around you, get rid of containers or old tires or pots, things that are just accumulating water and having promoting the breeding of mosquitoes. That can help. You can do indoor spraying in your house. You can do insecticides. You spray periodically inside your house. Another thing is vaccine. There's a vaccine nowadays. It was for malaria. It was approved by WHO, I think, like a year or 2 years ago, and even in Kenya, it's being rolled out. But unfortunately, it's only for children.
So it's been added to the...
Yes, especially in the endemic zones, in the places where they're at high risk for malaria. So you find they're given at, I think it's 6 months, 7 months, 9 months, and I think another one at 48 months. So that one, the initial version, or the first version of the vaccine had up to 30% protection factor, but they improved on it to now up to, I think, 60%. So those are some of the things that are being done to reduce or to prevent the spread of.
So the vaccine kids, it's given 4 times.
So
inamaanisha akiwa mkubwa atapata malaria hata akiwa.
In a reduced risk. Nothing is 100%. It reduces risk. Yes, and also we talked about the medicines, the chemo prevention, so that can also help to prevent malaria.
Okay, that's a good one. You said a year ago.
I think 2021, if I'm not wrong. There was studies being done in Kenya, so there was a study part, and then now it was officially.
That can help.
Yeah, it does help.
Okay.
Yeah.
So now, I saw people also. You treat the nets. You can treat it at your own home, like the nets. Kuna venye unaweza hata kama si ya gavani nini ile yenye niko nayo kwa nyumba. Can I treat it?
I'm not sure about that one. Because now, do you know the chemical? Which one are you using? Because there's a permethrin with PBO. Like, do you have the right compound? Are you going to be using the right quantities? I wouldn't really advise for you to do it to DIY at home, but just...
Okay, so maybe that's
I would recommend you get one from the proper facilities. Most government facilities, they'll be able to give you. Yeah.
So we will not DIY. Coming to the to more of your experience now with the malaria. Let's talk about how did it affect you, especially in your life? Kulikuwa na longer lasting effects after that, that probably what's it called? Yani ilikusumbua at even after being treated. Were there any kind of symptoms or lasting effects that actually affected you later on?
Based on the symptoms I got in the 2 episodes that I was diagnosed with malaria, because see, a normal person is able to do activities of daily living.
Yeah.
So imagine when you're sick, you cannot do anything. You depend on somebody. Like you said, in your instance, people had to come and wash you. They have to do things for you, and then you're used to being independent. A very independent person, you can help family in doing this and that. Now once you're sick, I had to depend on people to take care of me. Like in the 2nd episode, I was totally down. I could not do anything. I could not eat. So I had to depend on people to feed me. So socially, it also affects you.
Yeah.
And remember, you're still going to school. No, you're not able to go to school. It's affecting like the whole broad piece of your life. You cannot go to school, you cannot think properly, you cannot do things you used to enjoy. So until I got recovery, it's slow. For the 2nd one, it was slow. So I continued with treatment, and then after that, I had to stay home to fully recover because some of the medications were strong.
Exactly.
Yeah, so I had to be nursed at home until I was back to strength, and then I went back to school.
Okay. Yeah. And when we're talking about that, the meds, honestly, they're really strong. So what happens to this woman who's expectant, or this under 5-year-old child? Are they given the same treatment?
They're given medications that are safe for them, for their age, for their condition, for their child, the unborn child, and also according to the weight for babies.
Okay.
So they're weight dosed. Yeah. So they're safe.
The same.
Yeah. Yeah.
Hey.
But there's some of those drugs some of them we can't give the pregnant women, so then they tend to be given the IV test unit. But even then, it's safe for them.
Okay.
Yeah.
Okay. And what happens if left untreated?
You die. Anyway.
No mistakes have been had.
Untreated malaria, there's it has a very big implication in terms of the morbidity, what you call morbidity, because now you see you can end up with kidney failure. Imagine you end up with kidney failure, you're going for dialysis twice a week because of malaria that was treated a bit too late.
Okay.
Yeah. Then there's the cost of, you miss out on work days. There's the cost of going to hospitals. Yeah. So there's that, I think untreated malaria has more devastating effects in the community and also at a personal level. There's the obvious death, there's the organ dysfunction, and also there's the cost of treating you for the government. If you're always coming every week or every other month, you're having malaria, it brings down a community. And you have to remember, for pregnant women, they're more at risk of having things like miscarriages or giving birth to babies who have low birth weight, you know. So there are those risks of having it untreated.
And they also, wanapatanga malaria sana.
They're at risk. Pregnant women, children under 5, and also people who are immunocompromised, people who have HIV, AIDS, or diabetes patients. Those patients, when their immunity is low. Okay. So they're more likely to get these infections.
So even for those ones, for those suffering from HIV and AIDS, the treatment is almost similar to this one who is expectant.
Yes.
Okay. Yeah. And when it comes to follow-up, so after the treatment, do I need to come back to be checked, like to test again? Can it reoccur soon enough? Okay. There are those questions.
Usually malaria, if you're given the right drug at the right dose, and it's a parasite that's not resistant, you should recover well. It may take maybe like a week or 2, but by the 3rd week, you should be back to normal. Actually, like she said, her first time, but the 2nd day, she was already feeling better.
That one was easier.
Yeah, that was easier. But if you now present with complicated malaria, it will take a while for you to recover.
Like cerebral.
That's like cerebral.
So, okay,
so you can have the risk of that.
Yes.
Then there's the other issue of now life after that.
What do you mean by that exactly?
No, as in, because your question is now like, after what happens in terms of follow-up. So we follow you up usually. If we discharge you from today, we can see you in 2 weeks' time or even in a month's time. We see, are your symptoms resolved? Are your organs okay? Especially if you had like really deranged, like your kidney functions were abnormal, your liver functions were abnormal. We can monitor that serially to see if you're improving. But also, there's some kinds of plasmodiums that are not resistant, but they hibernate or they hide in your liver. Like Plasmodium vivax and ovale. So you find that we've treated you, but then you have a relapse in a month's time. So usually when you're doing like the way I mentioned, the thin smear, which shows you the kind of plasmodium that you have. So if we know that it's this kind of parasite that tends to give us relapses, to your kawaida medicines, we add something else like primaquine. We add another drug that just goes to target those hiding parasites inside your liver. So there's that risk of relapse or recurrence, especially with those types of plasmodiums.
So it happens.
Yeah, it happens.
You actually relapse almost immediately. I took time between the first and the second one.
A year apart.
Oh, a year apart.
Yes.
Okay, you at least alikaka kitoko. But it's not even funny. And there's also a question of, you've mentioned about repellents. Are there people who are allergic to it?
Yeah.
So now, how do you can't use that?
Yeah.
How do you know if you're allergic? Kama lazima upake ndo ujue. And how effective are they?
They are quite effective because the purpose of a repellent is to prevent mosquito bites.
Yeah.
So those compounds have been found to actually deter mosquitoes from biting you. So there are various compounds. There's one they call DETT. I may not remember the dimethyltolamide or something. So you find the recommended concentration in those formulations around 20 to 30% should give you 12 hours protection. Then we have another one called picaridin that's usually found now in lotions. That one is odorless and non-greasy. Concentrations of around 20% have been found to be effective. There's also what they call like the oil of lemon eucalyptus tree is also useful. So my advice would be most of these compounds or items, they can be readily found in supermarkets or pharmacies. Read the instructions, see if there are any things there that are screaming out that you may be allergic to. Do a test, do a patch test. There you can do like on a small area on your skin before you start applying not the whole face everywhere.
Or you also apply on the face?
Yeah, so just do a patch test to see how is your skin reacting. It's okay, then now you can go ahead with it. Then of course when you're applying, you apply on the exposed areas. Don't apply on your body, then you wear your cloth on top. Doesn't make sense. Then on your face you have to be careful around your eyes, mouth, nose, ears. Yes.
Okay.
Yeah.
Yeah, that makes sense. Even as we're winding up, probably what would you tell people about malaria awareness? What should we look out for? What should we do better, especially even in terms of advocacy? What should we do better as a country to make sure it ends with us?
I think personally my main pain point for the community is get tested. If you have the symptoms which you've described and you're feeling malaria, the way we like saying it, please be tested first before you take medication. somehow. And if you have a history of travel, especially to these areas, please just be tested. Don't do over-the-counter anti-malarial medications. Yes.
Hata hii yenye tunasema tuna prevent kabla tuende, we don't do.
The way I mentioned, you first go to a doctor.
Sawa.
And that's preventive, remember, it's not treating.
Okay.
Yeah.
Okay.
Yeah, that would be my take home to the people.
Okay. And from you?
I could like to echo what Dr. Favor said. Please don't do over-the-counter medication. And if you feel like you have symptoms, like I say, there's some symptoms that are similar to other conditions like joint pains, fever, chills. So if you're feeling like you're having them, please don't go to the chemist. Ensure you go to the facility near you, get tested and be treated for better management and quick recovery. Yes.
Okay, thank you. In terms of advocacy, bado mnafanya awareness everywhere. Hata Nairobi, si tumefikiria hata malaria iliisha. Unaona sasa niko like haja. Bado watu pata. Hebu nisiseme hivyo alafu nipate. So yeah, let's continue with the advocacy also, creating more awareness. Even here in Nairobi, Mali atujui sawa. So where can people find you in case they want to find you?
I'm a physician. I run the physician clinic at Luton Hospital, so I can be found there.
Sawa.
Yes.
Wapi? Wako wapi?
Oh, Ngong Road at China Center.
Social media platforms. Mbona mwingiangi?
No, mimi personally. But Luton Niko. Follow us on our channels at Luton Hospital on LinkedIn, Instagram, Facebook, TikTok. We are there.
Wow, thank you so much for joining us today. Thank you for also creating the awareness. We are marking World Malaria Day, and yes, clearly it ends with us. It ends with us today here on Health and Wellness. Find this episode on YouTube at KTN Entertainment, and also on our social media platforms at KTN Home, on IG, on X, and on Facebook at KTN Home. Until next Sunday, see you same place, same time, 6 p.m. to 7 p.m. This is Health and Wellness here.